Welcome to The Sensitive One, a podcast all about living in the world as a sensitive person. I'm your host, Gina Susan Long, nutritionist for highly sensitive people, and today we're going to be speaking with the Food Intolerance Dietitian, Frances Walker. Frances Walker is a dietitian based in Melbourne, Australia, and as a dietitian, Frances is all about individual empowerment. She helps people to find just what they need to know to live their best life. That includes understanding how foods are affecting them, or even their babies, something that we'll be discussing next week in more detail. Frances helps people to uncover food reactions and shows them how to modify their diet. She has a very balanced approach to treating people with food reactions, which is not about avoiding foods for the rest of your life. In this interview, Frances is going to help us to understand the different types of food reactions that can affect people, and some of the maybe unexpected symptoms that can be linked to food reactions. Frances is such an easy person to talk to and such a wealth of information and support, so I hope that you enjoy this interview as much as I did. And with that, here's Frances Walker, the Food Intolerance Dietitian. How about you introduce yourself, Frances? So can you
Sure.
tell us a bit about you
Okay.
and what you do?
Yeah. Okay. I'm a dietitian with a good 25 years plus experience behind me. And after working in so many different areas throughout my life, I happily landed into food intolerances, which is a bit crazy because in the first year of learning to be doing my nutrition and dietetics, I decided this was an area I wanted to work in, as well as working with the gut. Anyway, here I am. Should have gone there straight away, but I'm glad I'm here now. And I have my own practice. I work as a food intolerance dietitian, and my areas are split between FODMAPs, food chemical sensitivity, whole food allergy slash intolerances, as I find that they're the main domains that have some scientific backing to it. But of course, there's lots of other things that happen out there that I feel that we don't even really understand or know about yet. So, interesting area for me.
And how did you end up coming back to food intolerances?
That's a good question. Well, I just really did all sorts of different jobs and I love different experiences. I really enjoy that. But I guess while my children were young, I just really took up jobs that sort of fitted in with my lifestyle. And as I got a bit older and didn't need me as much, which is a funny thing because they always need you at the end of the day, I decided I really wanted to go into private practice. I had been working in a gut clinic with people with incontinence issues and started working with FODMAPs pretty early on in the piece and just loved seeing really the fantastic results you could get in this area. And I guess I'm a big person for uh, I love getting good results, good, hard, fantastic results. I don't love working with weight loss. It's very hard to get the really great outcomes.
Interesting that you say that you think or you feel that you get better results from working with people who have food intolerances. You know, I think of food intolerance as something that's quite challenging, but you obviously know what you're doing. So,
It is. It's really challenging. Sometimes I wonder why I'm doing this. but but to be perfectly honest, it's I guess, it's much more related to biochemistry to anything I've done before. And that's really been my main reason why I went into dietetics. I loved biochemistry. It is really, really tricky, and even as a dietitian specializing in this area, in the beginning, it took a while to get my head around all those areas. It really did. And so for someone who's suffering from these conditions, from these situations, it's just insanely hard. And to be able to actually put it together, because I mean, we humans, we love to put things in their little boxes and say your FODMAPs, your food chemicals, you're this, you're that. But in truth, it's not like that. It's a bit of this and a bit of that. Might be more towards one area, but the way we actually exist is not in little defined boxes. So it actually is really important to have an overall understanding. And yes, it takes a long while to get to that point. Absolutely. Luckily, I absolutely love learning, and I love looking into information and putting information together. It's probably my favorite thing. So that particular challenge actually was a challenge that motivated me more than anything. But sometimes I do wonder why when it's because it is super tricky. There's no doubt about it.
Yeah. Do you find that people who have food intolerances are quite motivated though because they're suffering so much?
Oh, absolutely. Absolutely. I sort of feel that um, my website seems to attract the more sensitive individuals from all around Australia and overseas as well. So I do feel the only reason I'm mentioning this is that I do see the very sensitive, difficult scenarios. And these people are highly motivated because the symptoms they have, I mean, they're just awful, and they're symptoms, multiple symptoms that affect all parts of your body that can change over your lifetime and impacting people on a daily basis. You know, they're lawyers who are finding it hard to think properly, and it just gets in their way. So that does tend to be a high motivation. And also, they've had a really long journey before they've come to see me. You know, this has been something that's been happening for them for 20 years often. But also, another cohort I work with a lot, uh, uh, breastfeeding mothers with their babies. And there's nothing more motivating than a baby that is waking every 20 minutes throughout the night through gut pain and ongoing gut issues. And, that's just very motivating. And what mothers do, it's for their babies, is amazing.
You were talking about some of the symptoms that people come in with. So when we're looking at adults, let's actually talk a bit more about what kind of signs and symptoms those are, because I feel, and I don't know if you agree, Francis, that there are many people out there who are suffering from food reactions but don't know it.
Yeah, this is a hard one, really, because we don't have the data on how many people out there do suffer from it. And I'm very wary of, when you work in an area, you tend to see it everywhere. And so I do try not to oversee it, but I do wonder. I mean, there's a group of problematic additives, and I do think that many people I feel do actually have mild sensitivities, but really nothing that gets in their way. So they just work around it. They just notice when they eat something that they get a funny feeling in their tongue, or something might give them a little rash or make them feel a bit uncomfortable. But because it doesn't happen that often, it's not really worth diving into and exploring and eliminating. Um, so I do think it is there in varying degrees, probably because there's a group of additives that we do take out as part of the food chemical elimination diet. Your MSG. You hear of a lot of people reacting to MSG, for example. That's probably a good example.
What are the other big ones in regards to food additives that are in foods?
Well, when we take out the food additives, we take out the artificial colors. That can be a big one with children. You often hear about mothers talking about with their kids how crazy they go at parties and climbing the walls. I mean, they kind of do that at parties anyway, aren't they? Because they're pretty excited. But, some climb the walls a little bit more than other kids. And they put it down to the sugar. And often it is due to the artificial colors. And there's also a natural color called 160B, which is a natto. And they're well known as being an allergen too sometimes. Um, and so that one natural color, and there's a couple of other natural colors that can sometimes be a bit of a problem. So they're often something that we see with children, and it's often not the sugar. It often is the natural colors that's causing the issue. And we can do this by when they're on elimination diet, they can actually do a little challenge of eating quite a few sugar cubes, and seeing no reaction. So that is a big one. And MSG and the other flavor enhancers, because MSG is 621 monosodium glutamates, but there are other glutamates as well, potassium glutamate. So there's the family of glutamates. We know about 621, but there are the other flavor enhancers that are just very similar. So a food being MSG free is not flavor enhancer free necessarily. And as a group, they're probably the more well-known additives. There's also like a few artificial antioxidants that sometimes people say that they have a reaction when they have fish and chips from a commercial fish and chippery. Now, most commercial oils will have artificial antioxidants, not the oils that we buy in the supermarket, but the commercial oils do. And that sometimes that pops up every now and then, not as common as MSG.
And it's not labeled either, is it?
That's an interesting question. It is labeled for the commercial oils. You do have unlisted antioxidants when the ingredient itself is less than 5% of the total product. So that's the 5% loophole. And the ingredient of that ingredient does not need to be stated. And so yes, for a food that has a high fat content, then it's more than 5%, then yes, it does have to be labeled. If it's less than 5% or less than 5 grams in 100 grams, then there is that risk of that antioxidant being there, that artificial antioxidant, and it's not listed.
Yeah. Yeah, I just thought it was important to point that out because I think a lot of the time that these additives that people respond to or react to are not always listed because of these loopholes. I think sulfites is another one.
Sulfites is an interesting one, really. Sometimes some foods that we are recommended as part of the low chemical diet do have sulfites in there, but the sulfites, say a sausage that is made from very fresh meat and is acceptable within this elimination diet, the skin does have sulfites in it, but it is widely recognized when we cook that sausage at the high temperatures, the sulfites will be boiled off. So it gets a bit tricky. We generally, as part of the food chemical elimination diet, reduce the sulfites. For those who are extra sulfite sensitive, it's a bit of a nightmare, really, because a lot of foods have sulfites in them. And as you said, they don't have to be listed because they're under the parts per million as per the law states. And they sit there and they don't have to be listed, sure. But most people don't have that ultra sensitivity, though some do.
And then the other thing is, I think with mincemeat and that kind of thing, that sometimes butchers will sneak that in there, or the people who produce the product, and not actually stay within the guidelines of how much needs to be declared.
Well, that's definitely very naughty. Apparently, they did do a bit of a checkup on the sulfites in mince because, as you said, legally absolutely not allowed. Don't put them in there. And they used to be put in there to make the mincemeat look, as because when you get the mincemeat, it starts to darken in color, so it keeps that nice light red color, looks fresh. So they shouldn't be, and that's naughty. And you can buy some sulfite strips to test for that yourself. But I think there was an audit done quite a few years ago, and it did find that it really wasn't generally been wasn't happening like it had been happening before. But it is something to be mindful, of course. And if it's done, it's totally illegal.
Yeah, I'm always a bit suspicious when the mincemeat looks too fresh.
I think yes, if it hasn't been minced straight away, absolutely. But I mean, sulfites are thrown onto, say, prawns, to keep the prawns nice, and the metabiphile site chucked on there to keep them nice and brightly coloured on the boat, just after they're caught. So that is something we tend to say to people: don't eat prawns because they will have sulfite added to them. And don't choose dried fruit that looks nice and coloured, because also the sulfites will be keeping that nice and freshly coloured as well. Go to the organic shop and buy the browner, less appealing versions, but they're only less appealing because we're conditioned to seeing these brightly coloured dried fruits around. Yeah, we perceive that to be is that is what we want. And I think there was the old age story of margarine when it was first made was naturally black in color, which was going to be quite off-putting for people. So had to make a few changes there to get a different color happening.
Yeah. So what are the other big additives that you think people might react to?
It looks very difficult to pick additives. A couple of additives I've picked up with people, like it has a few times, has been the nitrates and the nitrites that you get commonly added to most deli food, in particular thinking ham, thinking bacon. And I've had a few people who have had stomach aches. It seems to come up as stomach aches for the cases I've been dealing with anyway. And we've been able to, swap over the bacon to a nitrate-free bacon and the ham to a nitrate-free ham, and the stomach aches just magically go away. So that's something that does come up enough for that to be really seen as probably, one of the big ones. But the thing with additives, it's hard to pick really what you're going to react to. So it's best to take out the whole group of problematic additives out, and then we have specified challenges we can do for one additive at a time. It only takes 3 days. So we can test out these additives, and the results are often surprising. And that really is the best way of doing it.
Yeah, and the additives are one of the easier things to remove in a way.
Oh, totally easily. If you, yeah, as I see it, this is how I understand it really. If people are food chemical sensitive, it might be enough just to take the additives out, but sometimes people have that little bit more food chemical sensitivity where it spills over into the food as well. And so just taking the additives out may not be enough. They may need to delve into the food and make some changes as well.
Yeah.
So it's something that is, you take educated guesses on these things, but really it's only until you take things out and see the response that you get an idea of what's really happening.
And what kind of symptoms are people experiencing when they have these additive reactions or even food chemical reactions?
What sort of things am I looking for?
Well, I guess I'm thinking for anyone listening to this, they may not know what kind of symptoms they would expect to associate with a potential food reaction.
Yes, yes.
What does that actually look like?
It can look like anything. I mean, there are such a range of reactions. And many of the food chemical sensitivity reactions, they definitely overlap with FODMAP reactions. They can have exactly the same symptoms. FODMAP is pretty much confined to the gut, although it does tack on some reflux and fatigue as well, and some bladder irritation. But it really is centered and centered around the gut. And food chemical sensitivities can have the exact same symptoms. So that can be a little bit tricky, sort of separating those two areas. And sometimes they can occur together as well, just to make things a little bit more complicated. But I guess what can make food chemical sensitive stand out, say from a FODMAP sensitivity, is the ability for this issue to affect every system of the body. And people in the same family, because these things are very genetic, food chemical sensitivities are very genetic. So people in the same family can have food chemical sensitivities, but have quite different impacts and symptoms in their body, so and react to different food chemicals as well. So that's why it can be a bit hard to pick out. So for one person, it might really affect their skin. They might get absolutely terrible eczema flares up, or rashes, or big swellings under the skin, which are particularly horrible for people. They often, some common symptoms are, I guess, are people talking about their tongue, having a geographic tongue, or having a tongue that's very, very sensitive and reacts in different ways. It gets itchy, it feels unusual, it gets tingly, and that can be an overlap with allergy symptoms as well. So this is where it can be a bit tricky. Another symptoms that can be affected is that you can have asthma issues, and sulfites are well known for exacerbating asthma issues. You can get migraines and headaches, and we've all heard about red wine and chocolate causing migraines, and that's just an example really of a common issue that you come across, even if people don't have generalized issues beyond that. That's something I come across a lot.
And you mentioned also that you have people coming to you that find that they can't think.
Yes, that's a really big one. I was about to actually just move on to the central nervous system, and so yeah, the foggy headedness, which is just, and feeling like they've been hit by a bus, is a really big one. It's almost the most commonly most common symptom that people describe. But also within that arena as well, particularly when we're looking at children, you can get a lot of issues with emotional regulation, with feeling easily upset or extra angry, and particularly with children, you get the silly salicylates and angry amines, which is a bit of a generalization. And often when people go on the amine challenge, they can feel so weepy and down and upset, and it's all not worth it. And that's actually part of the reaction quite often. And because these things are, it's not like when you have FODMAPs, they're in your gut, and on a low FODMAP diet, you can get improvements within days. With a food chemical sensitivity, it takes a while for them to come out of the body because they're very drug-like, and they have a half-life that is similar to drugs. And so it takes a while for the base load to come down and for the substances to be broken down and excreted from the body. So it takes, when we're reacting in a food chemical way, it can go on for quite a while and just gradually start moving off and having more good days rather than bad days. So these things are not clear cut. They're actually can be just incredibly confusing. But I guess for people, if they might They may not join, often they don't join all the dots for all these symptoms. I put out a pre-questionnaire where I write down all the symptoms and they can go through and tick off and what things are the main symptoms for themselves, which things are the minor ones, how frequently it occurs, etc. And it's only then that they start putting the dots together and realizing, oh gosh, I didn't realize that could be a factor in this. But of course, something like headaches and migraine can be caused by other things as well. So one has to be careful not to overread into these symptoms.
Yeah, and I think when we're talking about food chemical sensitivity, it can be difficult for people to through observation kind of pinpoint what they're reacting to, because a lot of the time they'll find, well, I ate this, particular food today and I was fine, but last week I wasn't. And that's because of the cumulative effect of the food chemicals in the body. Is that right?
That's completely right. I think that is the thing that really is the most confusing for people is that's why you tend to notice the issues with additives because there's such a high concentration. You eat the food and bang, you have a reaction. So connections are made with food additives. And so if I see someone is food additive sensitive, it is also highly likely that they're also going to be sensitive to the food chemicals in food. But as you said, it's very hard to notice it. There's a couple of foods that do stand out, and some having some juicing, they might find that they react when they're juicing, when they're having something that is rich in tomatoes, and so you're getting a real concentration of salicylates, amines and glutamates, and it's way more obvious. But just as you explained so well yourself, or as you brought up yourself, is that there is an absolute threshold to this. And so you can eat some strawberries and have lemons and eat corn and have products with salicylates, amines and glutamates in that. And, one day you might eat tomatoes and you're fine because your base load is quite low in the body. But each time you eat another food, then it increases the base load, increases the amounts of that food chemical in your body, that naturally occurring food chemical. And it takes a little while to break down because it's got a long half-life. And then you eat some more food, and before you know it, you hit your personal threshold. And your personal threshold is different to the next person's threshold and is very dynamic depending on how well you feel, how stressed you are, if you've got hormonal issues happening, if pre-period or a period of growth. That's a very dynamic threshold. Anyway, once you pass that threshold, bang, that's when your symptoms are set off. And that same food may have been eaten 2 weeks earlier, but because your base load was so much lower, it didn't reach your threshold. So when I explain that concept to people with the aid of a table, the penny drops and they say, that makes sense. I mean, with all my knowledge, when I track people's eating plan and look at their symptoms, I can't match up when their threshold is hit. You just can't read this stuff yourself, even with a trained eye. And one of the reasons for this is because, everyone's responses are going to be very different. And there are a lot of other variables besides diet. We react to these chemicals around us in our environment. If we have an oil diffuser going on or some products that we might use, or, we know about getting headaches from perfumes, for instance, go into one of those lash shops and, people who are food chemical sensitive, who are sensitive with smells, wouldn't be able to walk into a shop like that. So all these things add to our base load as well as things that we have our toothpaste, we have our medications we have, because there are a lot of additives in medications. So we're getting these things from different areas of our world, even some people, there's been a handful of people who are sensitive to the water but are fine with a tank water in their country house where their parents live, for instance. So it's a multi-factor scenario. We live in a high chemical world, and unfortunately some people just have that sensitivity.
So I'm just thinking there might be people listening to this who actually have no idea what you're talking about. So what is a food chemical sensitivity? What is a food chemical? Maybe you could elaborate a bit more on that.
Yes, I can. So the food chemical sensitivity, it first came out of the Feingold diet. I don't know. Lots of people have heard about that. Perhaps you've heard about this diet that helps children with ADHD. And in that, children with ADHD might react to colors or react to certain foods and makes their behavior spiral out. So this diet sort of had its origins in the Feingold diet many, many, many years ago. And since then has been developed by the Royal Prince Alfred Hospital in Sydney. And while we don't have the strong evidence studies as a backup for this particular diet because it doesn't lend itself to those placebo controlled studies, unfortunately, which makes it very difficult for, I guess, the medical fraternity to accept this diet. However, we are led by RPAH, and honestly, people who have a food chemical sensitivity can get a lot of relief from this diet when before this they've had all sorts of interventions, often surgical interventions to deal with their issues. So, it's something worth trialing. But what is it? It's food chemicals. So we're looking at salicylates, amines, glutamates, and certain food additives. And so salicylates come from plants, and it's a naturally occurring chemical. And it is the plant's defense mechanism. And for people who have just a food sensitivity for some reason, whether it's they just don't have certain enzymes in their body that puts a bit of a road blockage in their metabolism, are unable to deal with the salicylates properly. And so, as a result, certain issues occur in the body depending on where the individual nerve endings are that are irritated by this particular chemical. So, salicylates are throughout foods that come from plants. So, certain fruits, certain veggies are going to be higher in salicylates than others. Amines and glutamates come from the breakdown of protein. Now, all proteins have glutamate in them, but when protein is aged or it's overcooked or existing naturally in foods such as chocolate, these broken sort of down fragments of the larger protein actually take a very active role in the body. And some amines we may have heard of are histamine, dopamine, tyramine, serotonin. And so, these are actually, they have very active roles in the body. So when we're absorbing these broken down protein fragments and going into our bodies, they can actually impact in our body and cause symptoms for people who have these sensitivities. And obviously, this is not the way it's supposed to be, but for some reason, something's not quite right, something's not quite working, and there's an over sensitization to these amines. And glutamates sort of fit in that same area as well. And glutamates, all salicylates, amines, glutamates actually make our food tasty. So anyone who's food chemical sensitivity, I can assure you your diet will be very high in these naturally occurring chemicals because, we gravitate towards foods that are tasty. But an interesting observation is that people who have this sensitivity often they sort of fall in two camps. The one camp is they sort of naturally move away from these foods without realizing it, and they're adopting a very plain diet without a lot of taste. And to them, food is just a way of getting by because they need it, because they've noticed that they get so many reactions from different foods. Whereas the other camp are people who are very committed to their food and it's almost as if this food sensitivity is entrenched in their particular relationship they set up. So going an elimination diet is really not nice for them. And I guess with the food additives, they often have a similar food structure to the salicylates, amines, and glutamates that we're talking about. So there is a unifying theme in their structure of these chemicals and the fact that for unknown reasons, our body does not handle them very well.
Do you have any thoughts or is there any research to suggest why people become food chemical sensitive?
There are general sort of observational findings, really. Genetics plays a big part in this. So if someone who has these issues, we delve into the family history, and they'll usually have someone, be it their mother and a maternal sort of line going back, or their father or their grandmother, who have had similar issues. But often at that grandparent level, people didn't really look into this sort of issue so very much. So genetics seems to play a really big part. But also some people, if they develop a hypersensitivity to Nurofen, and that can actually topple them over into food chemical sensitivity. And maybe they had a predisposition anyway. Often post-viral, post-bacterial, got something that can damage your gut, that certainly can set up FODMAP issues, and maybe with food chemical as well, that could be a thing. But we really don't know. But certainly genetics plays a big part. And I'm almost tempted. I almost say to young people now, if you've got food sensitivities and, you're finding a partner online, just maybe put in a little questionnaire and see if they've got food sensitivities as well, because maybe you don't want that for your children.
Yeah, maybe.
Well, a joke really, but I do see a lot of food sensitive babies where when both parents have issues, the babies often have a lot of issues.
Yeah, yeah, that makes sense. It's unfortunate that that happens. Can you also, perhaps going back, also explain the term FODMAP? Because people probably hear that term a lot. Some people don't actually know what it means. What does that actually mean? And what is a FODMAP sensitivity?
Yeah, so FODMAPS is an acronym. So FODMAPS, and it really it stands for a collective of small carbohydrates that are known to upset the gut in people with irritable bowel syndrome. So the F for FODMAP stands for fermentable. The O stands for oligosaccharides, which just means slightly longer short chain uh, carbohydrates. This is ridiculous. This is such a biochem thing, really, isn't it? Um, D stands for disaccharides. So disaccharides is basically a two sugar unit, and what they're really referring to there is lactose, so lactose intolerance. And the sorry, just to go back to the O, which is before the D, that the oligosaccharide stands for the FODMAPs that we find in things like wheat and onion and garlic. We call them oligosaccharides. So the fructan oligosaccharides and the galacto oligosaccharides that we find in legumes, which we know often cause issues with people with gut problems. So F, fermentable, O, oligosaccharides, D, disaccharides, which is lactose, and then M is monosaccharide, which actually just equals fructose. And we've all heard of fructose sensitivity, and we all often see foods that are labeled as, fructose friendly. But you have to put a little question mark there and say it could be fructose friendly, but what about the other FODMAPs? That's often an issue that occurs. So, and fructose issues can be inherited. Actually, there can be a problem with these different FODMAPs for different reasons. And then we're up to A. A just stands for and. And the last one is P, which stands for polyols, which is another type of FODMAPs, a short carbohydrate containing FODMAP, which is polyols and mannitol and sorbitol. And there are other ones as well, but they're the two major ones. And so these little polyols, they're actually none of us absorbed polyols, and they have a sweetness associated with them because they are little sugars. And because we don't absorb them and they exist naturally in food and they give a sweetness, they're often used as additives like an artificial sweetener, I guess, because they'll give the sweetness and we don't absorb them, so they've got no calories attached to them. But if you've got FODMAP issues, then you can't handle these little short chain carbohydrates for different reasons. You may not be able to handle lactose because you don't have the lactase enzyme. You may not be able to handle fructose because one of the fructose carriers across the gut wall is not working as well. We have two carriers, and one of them tends to work all the time, and the other one is more genetically defined, and so that might be downregulated. For some people, just genetically, their fructose carrier is not working so well, so they won't be able to absorb as much fructose. And in terms of the oligosaccharides, those little bigger short carbohydrates, the wheat and the garlic and the onion, we're not meant to absorb those. It's the same with the polyols. They're meant to make it to our large intestine, and so we can feed our gut microbes. But altogether, with all these little carbohydrates, they're not being absorbed for different reasons, and so they're making it, go into our body. We eat it, and they go into our stomach, it goes into our small intestine. They're not being absorbed very well there. Go into our large intestine, so they're in much larger amounts than they should be, and they're attracting water into the gut because they shouldn't be there in the first place in such large amounts. And the microbes are really happy because they get all this extra feast, so they gobble it up and they rapidly ferment it, which is the first word in FODMAPs. So these are very readily fermentable carbohydrates and produce a lot of gas. And so we've just got a lot of volume and gas and water in the gut. And our stretch receptors pick up on this and they're not very happy about it. And they send it to the huge amount of nerves that inhabit our gut, this is the gut-brain axis, which sends a message straight up our spinal cord to our gut, and it is received as pain. And we get the symptoms of bloating. You can look like you're 9 months pregnant sometimes, and gut pain, and you can get diarrhea or constipation or varying between the two. Different things can happen. That's a very individual thing. And it's really uncomfortable. And because that pressure differential that is set up in the gut You can sometimes get some reflux, and because of the proximity to the bladder, of the nerves in the bladder, very close to the highly complex, almost second brain setup of nerves in the small intestine, you can get a bladder that's irritated as well. So you do get these other flow-on effects, and you can get a lot of fatigue. Don't know why, but that's a very common factor. But the great thing about this, best thing about this diet is that it's a difficult diet to get your head around, but with good guidance, and it's good to get some help with this, because if you can do it properly, within a week, within days, you can actually just have a reduction or a reversal of symptoms by taking the FODMAPs out of the diet. And so it's a great diet for getting results. 75% of people who go on this diet who have IBS will get significant improvement. So it's a terrific thing to be able to provide to people, and to be able to do it for a way with them that makes it as easy as possible, because it is a little bit overwhelming. And if you don't get help to do it, you may not realize little hacks you can do, like you don't have to go gluten-free. You can actually have wheat in your diet. You just have to make sure it's low fructan wheat, and use sourdough, so you don't have to use gluten-free bread, and various things like that can make a big difference to doing this diet properly. Because if you do it properly, then you're going to get results sooner.
And once people have gone off these FODMAP foods or high FODMAP foods for a period of time, do they find they can reintroduce them? And also, are people who are FODMAP sensitive equally sensitive to all FODMAPs, or do they find that they can reintroduce certain things and they don't actually cause an issue?
Absolutely, absolutely. In fact, sometimes you can get a bit of a feel like, you go through the different FODMAP subgroups, and some people might be very aware and say, "No, I'm absolutely fine with mushrooms." So, mannitol looks okay, or I'm absolutely fine with eating wheat, and so you may not have to take the wheat fructans out. So you sort of individually tailor that diet if that information is there to be able to use. But in the mainstream, people are not so sure exactly what's affecting them, and so often might need to take out most of the FODMAPs. Often we might be able to leave lactose in there. There's a bit more awareness of whether lactose is an issue or not. And look, it's best to do a collective approach when you're not sure, and because absolutely there'll be some of those FODMAP subgroups that are going to be a problem, and some of them that may be fine, or there might be only a mild issue with one of those little FODMAP subgroups, which might be harder to pick up on. And the thing is, the elimination and the improvement tells you, yes, this is absolutely useful for you. Now let's tailor this, and everything before then is an educated guess. Now let's actually find the actual culprits. Let's find out if you're going to be okay with sorbitol and mannitol, because there's no point restricting foods that you don't need to. It's not good for you. It's not good for your gut, because it's really important to have FODMAPs in our diet to the maximum amount tolerated. In fact, taking FODMAPs out of your diet, even if you are more diarrhea, sort of leaning towards diarrhea rather than constipation, loose stools, it can really dry out your gut and move you towards constipation. So if you're starting off with constipation, it's really important that we do what we can to not make that worse. And look, for instance, most people will avoid legumes because they've noticed that legumes is a real issue for them. Well, you can have some legumes in small amounts, in low FODMAP amounts. And in fact, tinned lentils drained and rinsed for a normal serve for half a cup is low FODMAPs. And so to be able to keep the healthy foods in the diet where we can, go through the challenge process, which is phase 2. Elimination is just phase 1. Go through the elimination process, which I must say, once people can sort of accept that they're going to start doing the challenges, they're very happy to do it, because they're very interested to see what's going to cause the triggers and what's not. And they've always got a safe place to go to if things go a bit, belly up for them. And then we can put things back in that they don't react to. It's just so much easier in the long term. You're not supposed to stay in the low FODMAP diet is supposed to be a medical test. It's not meant to be a long-term diet.
So what's the
Yeah.
goal with the ultimate goal with going on the diet then? What's the long-term outcome?
The long-term outcome is to be able to manage your symptoms with the minimal amount of diet manipulation, with the minimal amount of exclusion from your diet. And really it's a lot more sustainable in the long term if you know that you're mildly sensitive to fructose, so you can have a certain amount in there without a problem. but you're really sensitive to fructans, so we're going to have to just be a bit more careful with those, but everything else you're okay. So you've only have to eliminate and make a few changes rather than a whole heap of changes, because I think really if you stayed on the low FODMAP diet, at some stage you'll come off it. When you're on diets, you tend to come off them. So you need sustainability, and the main aim is to really manage your symptoms so they're not getting in the way of your normal living every day. I guess really when people have had a bad gut for many, many years, it's also a bit of retraining that, yes, sometimes guts won't be overly happy. We might have excess gas one day, but that's okay as long as it's not an ongoing issue and get in the way of your normal life. So it's retraining as to what is normal, and variability around the gut is very normal.
Okay, so do people ever recover their tolerance of FODMAPs?
Yeah, some do actually. Sometimes, and the same with food chemical sensitivities. Just sometimes, look, the gut's been triggered for a while now. It's been continuously having foods that's upsetting it. So just giving your gut a chance to just settle down means over time, I don't know if there's some healing going on. I've no idea. But over time, tolerance does seem to improve. So if you go through the challenges and you find you're very sensitive to a lot of the subgroups, then you will try it down the track again. Maybe you'll try it in another 9 months, 10 months, or even 6 months, and to see if there's a bit more improvement, if you can take a bit more. But it is very common to see sort of an improved tolerance over time. It does just take a little bit of patience and time.
Is part of that perhaps that FODMAPs feed gut bacteria and can actually exacerbate the problem because there is more bacteria there that's
Well, I
eating
mean,
the foods?
theoretically, that's possible. We just don't know enough about the biome, really. Uh, Theoretically, you can't imagine having a restricted diet that restricts healthy food is something you want for your gut in the long term. It's
Mm.
really important for your gut to have a range of whole grains, for instance. And really what we eat is so important. We often think about taking probiotics and taking specialized things for our gut, but I think the best thing we can really do is eat well, have a balanced diet, have a range of vegetables in particular. None of us eat enough veggies, a range of colors and a range of whole grains to nourish our gut going forward. So anything that places a restriction on our gut must be restricting what we can do in terms of food and health, absolutely. But we just don't know enough to be able to definitely say that with an evidence backing it, but it just makes sense.
And what about whole food intolerance? I heard you mention that earlier, and I actually haven't heard that term before. What is a whole food intolerance?
Yeah, it's actually a bit sort of hard to get these concepts across in a way that's understandable for people, I guess. But a whole food, when you talk about FODMAPs, we're talking about all those little carbohydrates that exist across a lot of different foods. When we're talking about food chemicals, we're looking at salicylates, amines, and glutamates that will exist across foods and across food groups. Whereas when we're talking about a whole food, we're looking at dairy, we're looking at milk, we're looking at wheat, we're looking at eggs. So really, an easier way to think about that is the allergens that people can have issues with. So whether it's eggs, tree nuts, peanuts, wheat, etc. So they're not across different foods; they're a whole food. If you sort of think about it in that way, and I guess we often associate whole food issues with allergies, but they also can be. You can have different types of allergies. You can have your IG allergies that you test for, and that's the allergy that is associated with anaphylaxis. So it's great that we can test for that. But also, sometimes people can have issues with whole foods and it doesn't come up on IgE testing. So we talk about those foods as being more of a non-IgE foods allergies, or delayed allergies, or cell-mediated allergies that we can't test for. Or we could use the word intolerance. It doesn't really matter which words we use, actually. The action that we take is the same, is that if there is a dairy protein issue that doesn't come up on testing, then we would eliminate that from the diet, see if we can get an improvement in symptoms. And if we do get an improvement, then we look at bringing, either challenging that to confirm, and then, but then bringing it in gradually to see at what at what point it becomes a problem. So finding the personal threshold. So, when I see people, it is not uncommon for them to have food chemical issues, FODMAP issues, and whole food issues. But you sort of the way you look at these things differently in your plan of attack. And they can be eliminated altogether, but they need to be separated in one's assessment of it. If that makes sense, does that?
Yes, absolutely. That makes perfect sense. So, a whole food intolerance would be, for example, I react to eggs, but I don't have an IgE response to eggs because I've been tested for that and it's come up negative. Yeah, so that would be an example.
That would be an example, and we don't know exactly why you're reacting to those eggs. It could be just, an allergy that doesn't go through the IgE sort of mechanism. Or it could be that, there were thoughts that maybe it's something that the chickens are eating that you're sensitive to. Something, a lot of soy is used in a lot of feed for animals. And if you've got a soy sensitivity, maybe that will come through. It's a bit of a long shot, but who knows? And for a while back there were colors being put into eggs and people were reacting to those colors. So you can react to a whole food for different reasons. Some people who are very reactive to amines will react to eggs when they're old, but be fine when they're fresh. So it's the more you delve into these things, the more complicated it can get. However, for our purposes, what we would do is that we would probably avoid that egg or choose very fresh eggs or, bring eggs in terms of bring it in a baked way and bring it in do an egg ladder introduction to see at what level you would tolerate that if you wanted to have that in your diet. And certainly you might think, oh, look, I just won't have eggs. That's easier. But for a child, for a baby in their first year of life, actually is important to have some exposure of eggs where you can. It's important to have those allergens in the diet where it can be in there safely. Otherwise, we can cause an allergy to occur. So,
Mhm. Yeah, so it's actually part of the preventative approach to reducing children developing allergies that they eat some of that food or a little bit of it.
That's right. That's absolutely right. I mean, I wouldn't, as a dietitian, I wouldn't be telling a mother to give their child directly something that it looked like they were reacting to. That's something they'd have to talk to their doctor about. We'll often look at doing challenges through breast milk, which is a wonderful way of seeing if a food is a problem or not, because you don't get anaphylaxis through breast milk. However, if it's determined that it's a non-IgE issue, then we can introduce that directly. We want to be very careful how we did that. But certainly a child that has parents who have a lot of allergies, it's still important for them not to avoid these allergies, but to be introduced to them in the first year of their life. And it literally there's great evidence to show that can help prevent allergies significantly.
Could you explain the difference between a food intolerance and an allergy?
Yeah, I guess you know what? It really comes down to the mechanisms behind. So, an allergy is going to involve the immune system, whereas an intolerance doesn't. And I think the difference in this is more in the understanding of it. I think there's a lot of grey around this
Mm,
myself.
yeah, I
Uh,
agree.
yeah, I mean, you know, if you're looking at, say, people tend to use the words also, I guess people out there in the community will use the words interchangeably because it is a bit confusing and medical staff will use it a bit interchangeably too sometimes. But if it doesn't involve the immune system, then technically it's not an allergy. But however, you can have food intolerance and you can have allergies. And at the end of the day, they are both involved in the release of, say, histamine and what have you. So there are certain mechanisms that are common to both of them, which is probably why they have very similar overlapping symptoms as well. So that is literally the best answer I can give for that. I guess from my point of view, I'm just interested to know it's not an IgE allergy, that it's not a dangerous anaphylaxis. Because if it's not, then it can be an allergy or an intolerance as far as I'm concerned. It doesn't really matter. And just out of interest, we talk about those main allergens that we have, but also every singular, I mean, people can have issues just with singular foods, like for instance, they might react really badly to carrot, for no good reason that we know of, except for because every food basically will have a certain amount of protein in there,
Mm.
and so if they react to blueberries or carrot, then so be it. They're just singular foods. They can be really hard to find, and often the benefits of going on an elimination diet is that it just reduces all the white noise and reduces a lot of the symptoms. So a lot of the other foods that we don't know about, for whatever reason that they're an issue, they're more likely to stick out and actually be more readily identified. And I find that happens quite often. Not the thing you can pinpoint when there's all sorts of food issues going on.
So, how do you diagnose a food intolerance? What kind of tools or assessments do you use?
Well, I like to send out to people a pre-questionnaire so I can get a bit of an idea before the consultation what's going on, because it's the devil's in the detail, and it's a lot of stuff to cover in a consultation time. And then I have a bit of a read through there and have a night before the consultation, have an idea of where I want to explore more. And I've got a lot of prompts through my questions to try and bring out any issues. So look into family history. That can be really useful, particularly for a baby. Look at the range of symptoms and ask about any noticed trigger foods, because that can be quite indicative of what's going on. And the type of symptoms, and it's a bit of a puzzle. You get all these little pieces that you can put together. And so if someone says, oh, when they have MSG, they're pretty sure that they react, and the type of foods that they nominate as trigger foods are very much within that food chemical world, then maybe that's pointing in that direction. So yeah, there are certain red flags that pop out, but I find out it's not until you're really in the consultation and really talking in depth about these things and probing a bit deeper, then suddenly this will often happen. The person will say, "Oh, I forgot to say," and then they tell you something, you go, oh, okay, well, that gives me a lot more confidence about going down this track. In that case, that's actually just based on that alone, I would go down this track. And it's hard to remember all this information, and it's just as you talk, it just triggers up, oh yes, no, I remember that when I was younger, I this happened to me, and when I ate dairy, every time I vomited, even when it was lactose free. And you go, well, yeah, we might have a dairy issue going on still. Yeah, so it's never just one little thing. It's really putting all the little pieces together. And look, really, at the end of the day, it's an educated guess, because you don't know until you do elimination diet. And people can be very nervous at the idea of, oh, what's the elimination diet going to show me or no? And I said, well, don't be worried about it, because whatever's happening has been happening anyway. We're just trying to uncover it. That's all. And I
Yeah.
think, oh, yeah, that's true. We're just trying to get a bit clarity around it for you. That's all.
I agree. It's the empowerment of knowing is so much better, because then you get to choose.
Oh, totally. And I think I'm an educator, as in my background's also as an educator. I just love information and I love sharing information. I feel I'm quite generous with it. I mean, my aim is to the people I work with, if they're interested in knowledge, and a lot of them are, I want them to become as knowledgeable as I am, but more knowledgeable, because it's their body and it's their situation. And so I think the idea is really important that you work together. I'm not the person here telling people what to do. That's not the right way about it, I don't feel. So, by passing over that information and sharing that information, sharing my insights, and it's a journey. You can go down little blind ends, and, but you need to be there for people as well. So they don't feel like, here you go, here's your information, goodbye, see you in a month. You have to be there for them, because it can be it's a tricky journey. And as I said, you can go down blind alleys. You don't always find the answers, but you learn a lot in the process quite often.
And I suppose, you get pretty good results from putting people on elimination diets and challenging them and finding out what they're reacting to. So,
You do, but I mean that doesn't always suit a lot of people. Sometimes it's best to try, and I try and be honest about the different ways we can do this. We can just start by taking out the highest foods that are a problem, and if you take a more gentle approach, often people end up delving down more into the stricter sort of elimination anyway. Because I think this idea of trying to do everything at once and get it right, that is a very hard elimination. It's just can be too overwhelming, really. So trying to do it in a way that is less stressful and suits that person's preferences and what's happening at the moment. Like during isolation, some people think it's a fantastic time to go do an elimination, and for others it really would be the worst time because it's stressful enough.
yeah. Yeah. So, from the sounds of things, when you do your assessment, you will look for certain food patterns that might indicate, for example, a type of food chemical sensitivity, like a salicylate intolerance. And then would you put somebody on an elimination diet for salicylate specifically and not test other food chemicals?
Well, I think the gold standard really is to do the collective, just like you do with FODMAPs. But really, it's you do because you think you can pick this is due to this and this is due to that, but sometimes you can't. But I mean, often I've seen people where they've just been on salicylates only, so I can tell them that amines exist and glutamates exist. But if they're getting good enough, if they get a good enough response via just doing salicylates with a little bit of fine tuning on that, then that clearly that's fine. But I think it's important to point out, because sometimes things can change and you can be fine. Look, I was just thinking of a particular person I saw who was doing fine on amines only, didn't know salicylates existed, absolutely fine, and then all of a sudden wasn't fine, and it, the food chemical sensitivity, the other sides to that equation came into play a bit more. So then we were able to delve into that. So I think it's important to know they exist, and if you're going fine for now, well and good. If it works, great, fabulous. But knowing that is a potential, you can delve into that down the track if only if you need to. So yes, if someone just wants to look at salicylates or just amines, sure, I'll walk with them on that journey, but I'll also tell them about what the other potentials are, because it's important to have other aces up your sleeve too. Things go badly.
I guess everyone's different too, because some people will want to dive straight into it and do the full elimination, whereas others might be a bit more reluctant and sort of want a bit more
Absolutely.
freedom. Yeah.
And how people want to do it is the right way to do it, because there are many ways to do the same thing. It's just really having that knowledge, so you're mindful of the path you choose and other paths that you could choose but decide not to choose, and that's perfect, really. I just don't like, if you're making a choice without having that information there, without knowing about that, then it's hard to make that full choice. But also, and I think about it in this way, like you can go through this whole elimination diet and you go through the challenges, and someone might find they're fine with amines and it's only salicylates, and glutamates are fine, and there's a couple of food additives thrown in there. Because if you're going to react to some food additives, you're not going to necessarily react to all of them. If you react to one, it's chances are you're going to react to more, but you're not going to, it's unusual to react to all of them. And then at the end of the day, it might be only salicylates you really have to worry about. Now, if by happy chance you've accidentally stumbled upon the salicylate diet and that fixes up all your problems or all the issues to a degree that's completely comfortable, then that's as far as you should have to go. Absolutely. But it is, sometimes you can just get lucky, because it's very hard in this arena to pick which food chemical is going to do what, because, in one person's salicylate issues is another person's amine issues with the same symptoms.
Do you find that people can get stuck on elimination diets as well?
Yeah, I do. I do. And that worries me. I mean, if in your challenges you find that you're extremely sensitive across the board, then you're very limited in what you can eat. I mean, that is the case anyway. Clearly, you were already reacting to all those foods. It can seem that, and there's a bit of controversy around that. I don't know what the dietitians at RPAH think. I'll have to ask them. But in my mind, I do feel people get more sensitive on this diet, but also, I think it's a bit like when you take caffeine out of your diet and you have a little bit more, you'll think, oh, I used to be fine with, really strong caffeine, and now I'm sensitive to a little bit. I think
Yeah.
that's
Yeah.
normal.
That is very much in line with my own experience as well. Yeah.
Yeah, but I also think over time, and it just takes a bit longer, that people can actually improve. Now, if these things are causing issues in your body and causing inflammation, causing chaos, really, in some way, you probably don't want that happening, really.
Yeah. So, how do people actually get better with food chemical sensitivity? Is it the same as with FODMAPs? Do they have to sort of find their threshold and reintroduce the foods and then build tolerance again?
Yeah, that's the sort of more scientific approach, more science-based approach, I guess, or the RPH-led approach, is that, you see, when you get a negative challenge result, say, to salicylates, it doesn't mean you don't have any salicylates. We just bring them back in the diet in a very structured way. Like you might bring it in for 3 days on, 2 days off at a small dose. And you need to have a lot of patience just to bring it in systematically. And having the days off just gives it a chance for it not to build up. So increases the chances it's going to be tolerated. And there's a few salicylate hacks, like, cooking it over 200 degrees, and so the salicylate content is decreased, spreading it out over the day, for instance. And so we try and bring it back in to find what your threshold is, and then drop back to where it's comfortable, and then push it up again to see if we can push up the threshold. And then over time, keep trying to push it up. And people do often find that they do get improvements over time. They just need that, again, that settling down time again. Now, for others, they're not going to be satisfied with only being able to have a small amount of salicylates, a small amount of amines. And so then they might try other things. And as in to heal their gut or heal their body, whether it's some homeopathy or whether it's the GAPS diet. So a lot of people will go in all those different directions. So I don't work at that level with those different directions. I really like to work with, I love science, and I like to work with the science evidence. And as it is, I'm working with food chemical intolerance, which doesn't have that, double blind control placebo level of evidence. So I'm not going to go beyond there again.
Yeah. Um, well, as you say, these things are still being researched, and unfortunately, we can't research everything. And I think that's one of the issues with the food chemical elimination diet. As you said, there's no placebo controlled trial. And that's because it would be difficult to do? Do you know why?
I would assume that it's just so difficult to do. When they did the FODMAP research, the landmark FODMAP research, you basically have to supply all the foods to the people. And you need to be able to have the placebo, so the people who are getting a very similar food, but they don't know the difference. Now, to do that to fit the low chemical sort of requirements would just be so difficult to do. The meat has to be really fresh. It doesn't lend itself to be set up to be able to provide people with the food. And I also personally think that we're looking at an area that has a lot of individual requirements. FODMAPs can be a bit more uniformed. This area less likely. So if you've got food chemical sensitivities, chances you're going to have whole food sensitivities as well. So you're going to have to take, if your gut's involved, then taking out dairy and wheat or / gluten is going to be required. If it's just ADHD, then you're not going to have to necessarily take out the same whole foods. So it's very different as per different conditions. So it's a bit harder to uniform that. You know what I mean? You need the numbers in each little condition, I think. You'd need to have all those who require these whole foods removed and this, and in large numbers.
And then it's also the cumulative effect of it as well. Whereas with the FODMAPs, the symptoms might be more immediate.
Oh, absolutely. I mean, you can, as I was saying before, you can get great results if it's done properly. Within 3 days, you can get great results. Sometimes the gut needs to settle down, but after the end of a week, you should get good results.
So how long does it take with the food chemical sensitivity elimination? How long till people actually see improvement?
Well, if it's your gut, it could be 2 weeks. If it's your skin, it could be 8 weeks.
Mm, yeah.
So you've got these varying times, and everyone's different around that timing frame as well. So there's too many variables, and I think in a way, you just have to have that individual approach with it. And there is some evidence absolutely to show the impact of certain food additives, and there is limited lower level evidence in terms of some amines, for instance. There is some evidence there. It's just hard to get the highest quality. That's all.
Mm. Yeah, I just thought it was really important to kind of clarify that, because I know I have heard from people who have food chemical sensitivity and they've gone to see a doctor and the doctor has said this doesn't exist.
Yes, that absolutely does happen. And I've sort of thought a lot about this, and I think, well, for people who have, I don't want to do the wrong thing by people. So if I felt a diet wasn't a good idea, I wouldn't actually want to do it. But the amount of issues these people have, and in dealing with these issues, they've had all sorts of invasive treatments, not just assessments, because you need to have assessments. You need to make sure other medical things are not happening first. It's very important to eliminate all that. But, after 20 years and having all sorts of invasive treatments that haven't worked very well or just worked short term, just changing your diet around doesn't sound as bad.
Yep, that's for sure.
Yeah. And you can, if it's too much, it's not uncommon in this area to give it a go and to go, you know what, this is not the right time for me. I'm going to just give it a go down the track when it's a better time for me. And, to have a couple of goes at it. And that's fine. You've got to do things in the right way for yourself, You have to, your job is to look after yourself. So to do it in a way that suits you at a time that suits you, it's very important.
And what about conditions like ADHD? You mentioned that a bit earlier. Is that related to food chemical sensitivity?
Yeah, it is. I mean, not always, just like eczema. I guess there's sort of two camps again. You can actually get some kids who are reacting with ADHD type symptoms to, say, food additives and some levels of it in food as well, depending on the level of sensitivity. And by changing the diet, a lot of these symptoms can just melt away. However, you're going to have some kids who are just organically going to have ADHD no matter what. But what you can find, not always, but what you can find is that going on the diet can just help the medications work better or not need as many medications. So it can help ameliorate it a bit. But there are some that, won't have any impact at all. Same thing with eczema. You can get eczema that can be food related, and just as equally, you can get eczema that's not food related.
Yeah, absolutely. Yeah.
Because we live in a world where our triggers are not always going to be food. They're going to be a lot of things. In fact, people are food chemical sensitive, and if they're really well controlled on what they're eating plan, and they're really happy and their life's much better, and suddenly they get big reactions, they immediately think it's the food. It's often not. It's often the environment.
Yeah, I actually had an experience with that. So I've had eczema since I was a child, and I've found that food has definitely affected it. And it was under control. And I don't know if there were certain pollens in the air or something happened, and I had this massive flare up, and I had not changed anything that I was eating or otherwise doing. And it was interesting that when I saw my doctor about it, she mentioned that there had been a number of cases of asthma. And I think the thinking was that there was something happening with pollens in the air at that time. So I was really, sort of interested in the idea that maybe that was because of environmental changes.
Yeah, absolutely. And look, it can go both ways too. Is that there are reports of reports of people who go on a lower their food chemicals in their diet and actually find they don't react to pollen as badly. So you get this kind of bi-directional thing going on too.
Yeah, yeah.
And whereas and yeah, so clearly there's sort of interactional things happening there.
Yeah, it's kind of like a bucket, isn't it? It can fill up. Yeah.
Yes, well, I mean, that is the terminology that is used, how full your bucket, and your bucket doesn't have to have food in it. It can have, like there are people who've been on that low chemical diet and they have not seen results because they're still on their old toothpaste, which has mint and flavoring in there. And so something like that can block the effects of everything else you're doing, which is, it is so annoying. This whole area is fascinating, but incredibly annoying as well. I was like, really?
And pet allergies as well, I think that's another one. So people can be reacting to their pets and not seeing results.
Yeah, that's right. Look, when I see babies, breastfed babies, we're looking at whole foods, we're looking at allergies, we're looking at, perhaps food chemical sensitivities for some of them because their little systems are so immature that they're going to, if someone's got a mild chemical sensitivity as an adult, as a baby, it's probably going to be quite pronounced because their little guts are so immature and their little systems are so immature. And if there's a strong allergy background, then we'd be looking at more the whole foods, so that you do get that sort of allergen background information that you also get for adults as well, which can be quite instructive. But a lot of these allergens we can grow out of, and some of them persist through life, and we just get a lot of things happening.
So you work with little babies. Do you find that they can be reacting to the breast milk?
That's where I work with the breastfed babies. Yeah, absolutely reacting to the breast milk. And it's commonly known that allergens will come through breast milk. And some doctors, I think, feel that the medical fraternity are more on board with this because there actually is very good evidence for this. Food chemicals definitely come through as well. And so I've had mothers with babies and they've taken out all the top allergens. They're following a diet that is dairy-free, soy-free. And this is not easy. Soy flour is in everything. Nut-free, peanut-free, tree nut-free, wheat-free, gluten-free, you name it free, often even throwing in other things like corn-free, which is just, crazy hard, which is not a top allergen. It's just somewhere where they often go. And then they've still got a baby that's screaming day and night. And then we've lowered the food chemicals and we've had instances within 3 days, the screaming stopped.
Wow.
So
Yeah.
with those sort of results, you go, I'm really pleased to be helping you. This is literally why I like doing what I
Yeah,
do.
it would be very rewarding and so stressful for the parent when they don't know.
Oh, it's so stressful. And my heart just breaks. These little babies, they're really unhappy in their poor little systems and they're really upset. They can't talk, of course. So all their symptoms are the same. They have mucousy green poos and excess wind and they're screaming and they're unsettled and colicky. And look, a lot of that's going to happen anyway, but it's kind of mothers have a feel when it's above normal, and they'll often be told, oh, he's got reflux, and they're put on medications that haven't been studied for children under the age of 12. And the risks of going on some of these protein pump inhibitors for babies it's really not good when you look into it. I mean, I don't like to say this to the mothers whose babies are on that because but if you can do it through diet,
Yeah,
definitely.
well, those proton pump inhibitors, they inhibit the production of gastric acid.
They do.
Yeah, so the
Yes.
baby's developing its gut microbiota, and so that's possibly going to have an
Hmm.
impact on the whole development of the gut microbiome.
Yeah, well, evidence points to things like leaching of the bones of the calcium, of actually creating food issues, of just impacting the gut biome. There's a full amount of potential issues there. And look, I can understand parents want to trial that because there's no just drive you insane, a little bub screaming the whole time.
Yeah,
And like there are some cases where babies will need it when they've actually got, if you do endoscopy and have a look down their esophagus and they've actually got evidence of acid hurting that esophagus. But mostly if you did endoscopy, and who's going to do that with a little baby really, that's not going to be the case. It's not going to be there. And sometimes you can go on reflux medication. It's not going to help them. But a lot of them, it does seem to help. And then they get stuck on it because when you try and take it off, and even if you go really slowly, you get a rebound gastric output. And so then that kind of confirms that it's really needed. So, I mean, if you do go on these medications, you want to try and, minimize, try and get off it where you can for the babies. It's a pity. It's just you don't want to be harming them potentially either.
but you have found that taking mum off certain foods has helped to settle that
Oh,
down. Yeah,
definitely. I work a lot in this area, and absolutely. In fact, there was a dietitian called, no, she wasn't a dietitian, she was a lactation consultant and a midwife called Joy Anderson, and she could see how much food was affecting her own babies and other babies, and she could see that dietitians didn't really we weren't taught this, so it wasn't something that we were on board with, I guess. And so she became a dietitian at the age of 50 and really spearheaded this whole area, wrote a book about it called Food Sensitive Babies, which you can buy online. And that explains, for any mother out there feels that they are food sensitive, then probably your child is food sensitive. This book might be worth getting if you've got a baby who's unsettled through your breastfeeds. And really, I read that book a couple of years ago and just went, wow, this is crazy good. I have to do this. I just have to do this. And so there are not a lot of people who work in this area. And so consequently, I'm consulting with people, all over Australia and with this. But it's absolutely, I just see it time and time and time again. It's just,
yeah.
it's not always food chemicals. Sometimes it's just allergens. So you've got to sort of be careful where you go. It's a tricky area because you've got to get the allergens back in. It's a very tricky area, but so many times you can get great positive results and have happy bubs.
Yeah.
Everyone's happy then.
Yeah.
Start gaining weight again. Wonderful.
Yeah. Well, thank you for mentioning that because I'm actually going to be interviewing Joy Anderson. So that's a good intro.
And I did not know that.
Yeah. Thank you so much for sharing all of your knowledge. And I really enjoyed, hearing you speak. So thank you. Coming up in next week's episode, we'll be talking to Joy Anderson, who is a dietitian and breastfeeding consultant. And she is going to be answering the question, can breastfed babies react to breast milk? Thank you for listening, and I look forward to spending more time with you next week.